In this video, we demonstrate the technique of using computer navigation for multi-ligament knee reconstruction. These are our disclosures. This surgery is technically challenging, so careful planning and execution of tunnels is important to prevent tunnel coalition and ensure anatomic placement. These arthroscopy images and post-operative CT scan demonstrate examples of tunnel coalition where graft integrity may be compromised. We use a CT-based navigation system to plan and execute femoral tunnel placement for a complex reconstruction on a sawbone model. CT-based anatomical landmarks and published techniques were used for tunnel planning. This screen shows the computer user interface after a CT scan of the sawbone has been uploaded for pre-operative planning. Starting with the LCL, the entry point is determined based on bony anatomy and the target selected to add the trajectory. The trajectory is then checked and once happy with placement is labelled appropriately. The popliteus trajectory is then added with the entry point measured from predetermined anatomical landmarks. With both lateral tunnels now in place, attention turns to adding the ACL tunnel. Despite planning recommended trajectories, it is evident that a tunnel collision would occur between the ACL and LCL tunnels. The LCL trajectory is altered accordingly. All views are then checked to confirm that no tunnel convergence is evident. Attention then turns to the medial side of the knee, where the anatomical origin of the superficial MCL is placed. This is followed by placement of the posterior oblique ligament tunnel. Finally, PCL tunnels are planned for double bundle reconstruction. The anterolateral tunnel is positioned first and the diameter set to 11 mm. The posteromedial bundle tunnel is then added again to the appropriate length and diameter. With all tunnels now in the plan, the images are checked to confirm no evidence of tunnel convergence and the tunnel entry points are correct based on CT bony landmarks. The setup for the execution of the surgery requires a camera-based navigation system. Active trackers are attached to the bone using 3.2 mm pins. The drill and pointer instruments are calibrated with the navigation system before predetermined bony landmarks, which can be identified arthroscopically, are registered. This is refined with surface mapping confirming accuracy within ½ mm. The navigation system is then used to guide entry point and trajectory of the drill pin. The LCL tunnel was drilled first, followed by the popliteus guide wire and tunnel reaming. This screen illustrates nicely how the trajectories of the drill pin and the planned tunnel are aligned during insertion. Finally, the PCL tunnels are added, again guided by the navigation screen. Reaming of the tunnels is carried out using conventional cannulated reamers. This is the sawbone specimen with all tunnels completed. A CT scan of the post-operative specimen was carried out, and this selection of images with planning overlays demonstrates the accurate placement of tunnels, with no evidence of tunnel collision. We have demonstrated using this proof of concept design in a sawbone model that it is possible to use computer navigation to accurately place tunnels in multi-ligament knee reconstruction. Thank you for watching.